My name is Clenton Farquharson and I'm the chair of the board of Think Local, Act Personal. And I'm a person who has campaigned for the rights of people with care and support needs for the past 20 years. The question, what I want the government to do to make adult social care sustainable is important because it affects me. And I'm one of many. I'm a person who uses both health and social care. As of more than 500,000 with long-term care and support needs in England. If all the professionals could listen to me and people like me, we could cut wasted time, money and stress. This listening has to apply across the NHS, social care and from clinical commissioning groups to local councils to sustainability transformation partnerships. If we can co-produce solutions, it takes us further. It helps stop the decline in my health and well-being. So, in a nutshell, first, the system has to change to allow people like me who live in the community to have a bigger voice in what we need. Second, funding should be directed to community-led programs like wellbeing teams, co-ops, community circles, helping people to pool their budgets. But this requires trust. Your trust of me, my family, friends and carers, and also of each other. Let's find some common ground as equals. As adults, the very act of giving me control improves my well-being. We know this at Think Local, Act Personal through the work and consultation that we do up and down the country. It also means easing up and recognising that there isn't a standardised approach to co-producing solutions. What's good enough for me in Birmingham may not be good enough for my colleagues like Martin Yates in Blackpool or for Sally Percival in Cumbria. Let me share with you the top 3 principles that guide me and how I want the government, NHS and councils to reflect them in their plans. First, I recognise that people are assets or strengths with knowledge, skills as well as needs. They must be supported in their communities to be engaged and empowered. A whole life approach. Secondly, I work to shift the power and control from public services to the community and those who are marginalised. And my third point, I recognise that everybody has important contribution to make. No one is smarter than all of us. So my question to the panellists is, how best would you make sure that the experience of people who use care and support services drive the government's proposal?